OSF Healthcare has started a new model to further support their patients, providing hospital-grade services at home, which is much different compared to those regular virtual visits with your doctor. Our Dylan Valencia got to learn more about this new program and is live outside of OSF in Rockford. Dylan, good morning. Tell us what you were able to learn about their new patient.
Manny, good morning. Well, I got to meet Audrey. She's 85 years old, and just a week ago, she had to be hospitalized here in person at OSF, and she had never heard of at-home hospitalization until last week. She was actually the 6th patient discharged in this new program in Rockford, and OSF is the first healthcare system to start something like this in the state of Illinois just a year and a half ago in Peoria. Now, 2 weeks ago, as of 2 weeks ago, they're starting it here in Rockford. Take a look.
Well, I have heart failure, and it's called an old heart, and it's not producing oxygen as much as it should be, and as a result I had loss of oxygen. It dropped down to 82. So I immediately had to call the hospital and be taken to the hospital.
Audrey was one of the first patients at the new on-call digital hospital. After 2 days hospitalized at OSF, she was given the option to go home, but not discharged.
It's inpatient care. So this is not outpatient, this is not home health, this is truly acutely ill inpatients who would normally be in a brick and mortar hospital. But what makes it different is not only are they having those virtual video visits every day with their physician, but they're also receiving in-person care provided by our field team of nurses and CNAs.
Audrey had never heard of such a thing and had difficulty understanding such a concept at first, especially since she lives alone.
Coming home was a memory of how desperate you can feel when you can't even get up out of a chair because you don't have the strength. And I was dreading that. This was a place of safety before, and then it became a terrifying place to be.
Each patient receives a tech kit that allows them to communicate with their doctors. Nurses and medical staff visit the patient multiple times a day and provides them with meals and medicine.
We're going to set up a hospital in your home. You'll be discharged within 2 to 4 hours. The tech people came ahead of time and set up everything. And so when I walked in, I had a hospital in my living room.
OSF doing this to free up beds at the hospital while aiming for quality care.
Ensuring that we're able to free up beds timely for patients who truly need to have that level of care inside the brick and mortar.
A nurse comes to my house at 8 in the morning and spends quite a bit of time with me, takes care of my vitals. This is a continuation of your hospital stay.
Now, there are some minor limitations. You must be at least 18 years old or older to be hospitalized at home and live 30 minutes away from OSF St. Anthony here in Rockford within a 30-minute travel time. We have more details up on our website, WREX.com. For now in Rockford, I'm Dylan Valencia with 13 WREX.